704-2170, or check her out on the web at artfulsurgery.com. And when you call Dr. Lee and mention Body Beautiful, you can receive a 30% discount on Radiesse, the filler.
The facial filler.
The facial filler.
Fabulous facial filler.
Just in time for New Year's.
Right.
We'll continue our chat with Dr. Lee, plus take more of your phone calls coming up next on Body Beautiful. Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Elizabeth Lee. We're talking about liposuction. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And remember, any advice we give you today, be sure to consult your own physician as well. Let's go right to the phone lines. Patricia, good morning from Daly City. Do you have a question for the doctor?
Yes, I do. I want to see if it's possible to have liposuction right after giving birth, or would I have to wait?
Well, that's an excellent question. You know, in terms of medical status, probably a couple weeks after giving birth, you'd be fine to undergo liposuction. But the issue really becomes that your body didn't, grow to full pregnancy, term pregnancy size in 9 months, and it's not going to snap back to where it was immediately afterwards, so that you have to kind of balance giving yourself a chance to lose some weight, a chance for your body to tighten up and recover before you just jump into surgery. So I don't think it's a bad idea to go in and have a consultation with a plastic surgeon relatively quickly after the surgery, so that you kind of know where you're starting. But I would guess that in most cases it's appropriate to wait a little bit to give yourself a chance to recover. And so I usually tell patients, I'm happy to see you right afterwards, but we probably won't consider surgery for 9 months.
Okay, Patricia, I don't know if you're still on the line. Is that your first child?
No, my third.
Okay. So
you know already your belly's not going back to where it was before?
Correct.
Okay. Well, then, in that case, it's also really appropriate to come in and talk to a plastic surgeon early.
Okay. We've talked about mommy makeovers before. Because the other thing that happens is the abdominal muscles stretch out.
That's right.
They don't sometimes want to come back.
Right. And we are doing immediate tummy tucks after scheduled C-section also, because if we have a patient like Patricia who knows that she's stretched out and knows that this is going to be her last pregnancy and requires a C-section, we're not advocating having C-sections just so that you can get a tummy tuck, but if you know that you're going to be having a C-section, it's your last pregnancy, your body was stretched out by your previous pregnancies, it's not going to get better on its own, then it is possible to do, with the cooperation of your obstetrician and a plastic surgeon who's comfortable doing it like I am, to do an immediate tummy tuck, deliver the baby, and then do the tummy tuck.
Well, who's a good candidate for liposuction?
A good candidate is somebody who is in good physical shape, whose body index is appropriate so that they're not hugely overweight, and who has lumps that they want to smooth out.
Okay. You do laser liposuction?
Laser liposuction is one of the things that I've started doing. I use the Cyton Pro Lipo setup. There's a lot of direct-to-consumer marketing out there. There are things that like Smart Lipo, and they all have their own names. But basically, the advantage of doing the laser liposuction is that we get some heating of the skin so that we may get some tightening. I'm relatively new using it, and I don't jump on any bandwagon to say this is the best thing since sliced bread until I have enough experience, but I'm liking what I see so far.
Okay, and once again, we can't say this enough, board-certified
plastic surgeon.
There are a lot of people jumping on the bandwagon.
Right.
You've got to be very careful.
Right. You have to be careful who's operating on you, because they need to be able to help you if there's a complication.
We're running out of time, and I can't take some of these calls, but one question was, can liposuction be used for breast reduction? And
liposuction can be used for breast reduction. I personally am not doing it because in most cases you require some other kind of energy to be delivered, like ultrasound or like laser, and I think that there are risks involved in leaving breast tissue behind that has been irradiated in some way by the ancillary energy that you're delivering.
Okay. Do we talk about this? We have a second. What about recovery time? Does it differ between traditional liposuction and laser lipo?
Really not. Really not. I mean, we're working underneath the skin, the same area, depending on, no matter which modality of liposuction we're doing.
Can you expect to just jump back and go right back to work afterwards?
I tell patients to expect to take a week off, and that's mostly because I think patients don't give themselves enough time off, particularly my women patients, and that they prolong their recoveries by working too hard. So a week to do nothing but take care of yourself.
Great information. Unfortunately, we are out of time. Dr. Lee, thank you so much. And for more information about Dr. Lee, you can call her at 510-704-2170, or you can check her out on the web at artfulsurgery.com. And when you call Dr. Lee and mention Body Beautiful, you will receive a 30% discount on Radiesse facial filler. That's it for us. Join us again next Monday at 11 for another edition of Body Beautiful. Thanks for joining us. Have a great day, everybody. For more information about our show, go to cron4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.